All right, folks, welcome to this live stream presentation, chat, discussion about the coronavirus and COVID-19. My name is Chad Gesser. I started this page on Facebook initially as an effort to kind of document this historical moment. I'm a sociologist and I teach at the Owensboro Community and Technical College. I'm not an epidemiologist, and I'm going to talk about that a little bit here in just a moment. But I started this Facebook page as a way to capture what was going on and how people in the Owensboro area were managing the COVID-19. As I'm sure you've experienced, it's been what are we, June 25th, so what have been March, April, May. It's been a little while that we've been dealing with this, and things have changed. All kinds of stuff has happened with this, as I'm sure you can relate. So I started the page, and I was interested to get, as I said, people's to share their stories about various things related to COVID-19. I was also concerned about how Owensboro Davis County may or may not have been addressing the coronavirus. I've been tracking the coronavirus as best as I can with the data that has been available since the middle of March, and it's something I've been doing almost every day. I started out with using data from the former Attorney General Andy Beshear, but I started out using data from the governor's office because that was the only public data available. So let me, before I go too much further with that, as I said before, I'm a sociologist. I do have a bit of a background and some experience in some public health initiatives. Because I'm a sociologist, I deal with data. And I ask a lot of questions about data. I don't look at data in order to prove a point about something. My brand of sociology really is trying to look at the best evidence that we have about something. And certainly when you have a public health problem or concern, such as an infectious disease, data is critical in tracking, in surveillance, and in better understanding the problem to promote the public health of a community and the health of individuals, right? So, you know, I don't have the exact training of an epidemiologist, but the work that epidemiologists do is very similar in terms of the data and the information that they use to do their work regarding public health. All right. Okay, so having said that, so what I've decided to do with this managing COVID-19 page is to gather narratives. I wanted to use that, and I've made that clear on the page. I want to use this in the future with students in my classes to go back and take a look at this point in time and how our community managed this. So I'm doing this for historical record. But I've also more recently am leaning towards, because I do have, I have a Facebook page, and I've been talking more about the data and presenting the data that I've been tracking, the way that I've been tracking and talking about it. So I'm thinking about using this this COVID page as a way of providing an educational service to anybody that's interested. I'm not, trying to replace anything. I ask questions I think that sometimes people don't ask. And I'm really going to stick to the data as best I can. I'm not trying to promote, and I'll be clear about this, I'm not trying to promote a political agenda, but I am trying to promote a public health agenda. That is something that is a concern to all of us. So some of the things I'm going to cover, well, frankly, I'm going to stick to the science and what I've been looking at, some things I find interesting as it pertains perhaps to the state of Kentucky and in Owensboro, Davis County. And that's what this particular live chat video presentation is going to be about. And I've decided to go on and talk about this now for a couple of reasons. I've been thinking about it for a while, but I'm getting ready to have surgery tomorrow, and I'm going to be out, down and out for a few days, and I wanted to go on and do this live chat now. That's one reason I wanted to do this. Just foot surgery, no big deal, hopefully not a big deal. But I also wanted to talk about this because I had an experience, and I learned about this yesterday, and it's generated a lot of discussion on Facebook. And here's the experience. So today is Thursday, June 25th. Yesterday, now one thing I'll say, I've been following the Governor Andy Beshear's press conferences, like I said, just about daily up to about 2 weeks ago, really daily. That was the only place that I could get information about new coronavirus cases for Davis County. And I'll talk about that a little bit more in a moment. But I understand yesterday that in Governor Beshear's press conference, he had the Director of Public Health, Dr. Stack, talk about some cluster of coronavirus cases that they've seen in Kentucky that originated from people that had gone to Myrtle Beach. Okay, now here's where that kind of relates to me. So in the last week of May, first week of June, my family had a vacation planned to Myrtle Beach, and we debated on whether or not to go. Just something real quickly, I'll tell you a few things about my family. So we were traveling actually with a group of 7 people. 5 of those people live in our home right now. Another person was my daughter who lives in Louisville, but she went with us. And another person was a friend of one of my daughters that lives in Owensboro. And I will tell you that my family has been really serious about practicing social distancing, using masks and hand sanitizer. And the rule of thumb that we have is not going to places where groups of people are located unless we have to. Some members of my family are at higher risk for serious complications associated with the coronavirus. So I've been the only one really since the middle of March that has ventured out in public to go to the grocery store and to do takeout from restaurants and things like that. So we're really serious about it. So much so that we all got tested. Actually, 4 of us got tested prior to going on our trip. And we were negative, which is a good thing. You test negative for the coronavirus, it's a good thing. And we also looked at Myrtle Beach to look at the number of cases and how serious the rate of infection was. And at that time, in late May, early June, in Horry County, which is Myrtle Beach, the rate was very similar to what it is in Owensboro, Davis County, which, if you don't know, the rate has been fairly good from about the middle of May to about the middle of June. Okay, and we're going to talk about new data here in a moment. So at that time, it was, we could manage it. We also knew where we were going, and we knew that where we were going, that it was less populated. So a lot of the pictures that you've seen on the media, national media, about these various places on the beach show these packed beaches and that sort of thing. And where we went, we've been there a few times, we knew that it wasn't going to be like that. And come to find out, it was not packed. It was a lot of social distancing going on. We've thoroughly planned out our vacation to be very careful about where we went to the restroom on the drive down and where we went on the way back. Here's a little key if you're traveling. Don't use a restroom. When you stop, don't use a restroom at a place where people normally use the restroom, like a gas station. So one thing we did is we figured out where the Walmarts were and where grocery stores, in particular Kroger, and that's where we stopped for restroom breaks. We wore our mask. We brought plenty of masks to take with us. Every time we got out of the car, we wore it. And then when we got back in, we took it off. And we also had plenty of hand sanitizer. This looks like a soap, but It is a mixture of aloe with this hand sanitizer that we have. So we were religious about this. So much so that we did that all the way down, all the way back. And when at our condominium that we stayed in, when we got on the elevator, we had these on. We had this with us all the time. This is more hand sanitizer. So we really were serious about what we did. So when I heard this about these clusters in Kentucky based on tourists from Myrtle Beach, it kind of hit home. And you know, we've been back home now for I don't know, 3.5 weeks or so. And actually I got tested this week, COVID tested again this week as a pre-surgical requirement for my surgery tomorrow, and my results came back negative. I think I would have already lived through it anyway because it's been so long. But so that kind of hit close to home, and so I started talking about, you know, our experience on our trip and how I think that you can live with this coronavirus. And you know, that's one thing. Another reason why I'm doing this video is that maybe it'll help some people to think about, you know, the extremes, right? Do we lock down? Do you stay in your home? Do you do nothing and protect yourself that way? Versus do we open up the society, the economy, because we need to? And how do you manage that? And how do you keep cases down? How do we manage that in terms of the rate of infection? How do we manage that in terms of the severity of the disease at the local level? And having said that, I'm going to speak a little bit to a small effort that I'm going to try to make, and I hope that some of you will consider joining me in this. But I'm going to hopefully contact the local officials, the Davis County Fiscal Court, the City of Owensboro Mayor's Office, the Health Department, and the hospital and emergency management, and ask them to continue on with the video conferencing and the messaging that they were doing for several weeks. They did these regular conferences and did a great job with it, informing the public and letting everybody know what was going on. And then they stopped doing that, and it looks like we might be seeing an uptick again. And I do believe that there is a need and there's a great importance to work on educating people in the community on wearing a mask, on regular use of hand sanitizer, and on social distancing. This is something that we're going to be living with at least through December. So, you know, this is not going away and it's gone. And, you know, I really do believe that as long as we as a community can continue to do the things that we're doing, that we can live as best as we can in the middle of this pandemic. So I'm going to come back and talk about that a little bit more in just a moment. You know, so right now at the national level, there's a competition between the importance of public health and the importance of the politics of the coronavirus. And I think that is can be a potentially dangerous scenario. So there's talk about how if you wear a mask, then you're making a political statement. If you don't wear a mask, you're making a political statement. And again, the danger of that is that this is a health issue. This is not a Democratic Republic political party issue. This is a matter of health, right? So there's also, you know, should the current president be having rallies? Should we have restaurants that are opening up? When we went to Myrtle Beach, they were in the process of reopening that week before and the week that we were there. And I observed people not social distancing, not wearing masks. And, you know, now we see this large spike in Myrtle Beach, and that is a direct result of not wearing masks, not social distancing, and not, you know, practicing safe sanitary health. Should we quarantine? There's also an issue of testing. I would encourage people in Owensboro, Davis County to get tested, even if you don't feel like you've got the sickness. and I'm going to come back to this in just a few minutes, about testing and being symptomatic and asymptomatic. Actually, let me go on and speak to that. So, one thing that I am curious about, and I don't have the data on this, the health department might have this. Typically, when we see that people have new cases, when we see communities and states, when we have new cases of the coronavirus, it's because people have gotten sick and they went and got tested and found out they had the coronavirus. That is what we call symptomatic, right? When you're symptomatic, you have, in this case, a fever, you're coughing, you have tight breathing in your chest, kind of pneumonia, flu-like symptoms, and we know that there's the pandemic. You go get tested, and that's how you found out that you got the coronavirus. Well, we also have an issue of people that are asymptomatic, and we know that people are contagious. When I say we know, the medical and the public health community knows, okay, that you could be contagious even if you don't know that you're sick. Even if you don't feel sick, you could still be contagious. So I may have the coronavirus right now and I don't feel like I have it, but if I start talking with you face to face and I pass on the particles to you, we're not wearing a mask, you could transmit the coronavirus that way. So one thing that I think that might be interesting to know is we look at the documented cases in Owensboro, Davis County, and they're pretty low, the documented cases. How much asymptomatic coronavirus infection is out there and we don't know about because people haven't gotten tested? So we know some of the issues with testing. Early on, it didn't really exist. The only people who were getting tested were those that really needed to be tested and to be put in the hospital and serious care taken with those people. But we haven't had enough testing until within the last few weeks for people to get tested. So we have an idea about how much is out there that's asymptomatic. That is going to be something going forward at the local level and at the state level that we are going to have to get our hands on so we know how much infection is out there. When schools open up, we've got the luxury of not thinking about these things right now because school's not in session. Generally speaking, it's not in session. I have a summer class I'm teaching, it's online. But there's already discussions locally about how schools are going to open up. How are they going to test? Is there going to be a testing protocol in place? And frankly, I'll share my experience that with having people that are at risk in my household, I have a lot of reservations about sitting. So we've got a 5-year-old, an almost 13-year-old, an almost 6-year-old, an almost 13-year-old, and a 16-year-old, and they're at 3 different schools. There's one of them right there. And they're in 3 different schools in Owensboro Public Schools. We have serious reservations about our kids going into school with other kids. If there's not a testing protocol in place, I frankly don't see how we can do that, right? So there's lots of issues around testing with the coronavirus. Again, if you have any questions, please feel free to comment below, whether you're watching this live or if you're watching this on replay on YouTube. Feel free to post a question below if you have a question. I'd be happy to answer it as best as I can, whether it's here on Facebook or whether it's on YouTube later on. Okay, so I want to show you some things. Okay, let's get to the data. I've been talking for about 25 minutes about various things, but I would like to show you some data that I look at, okay? And I want to show you some things that I looked at for somebody that, kind of is interested in this and tracks it. And I'm going to show you some things that I noticed locally that really got me into, starting to track this a little bit more and talk about it a little bit more locally. So in order to do that, I'm going to share my screen with you. And so let me get some of this pulled up. And the first thing I'm going to show you actually, hopefully, is I'm going to show you some of the most recent data about local cases of the coronavirus, okay? So let me see if I can make this a little bit larger. I think that I can. Yeah, there we go. That's a little bit easier to see. So what you're looking at is some data and a chart that I put together that looks at new cases of the coronavirus. And I started looking at this. I believe it was first reported in Owensboro, Davis County on March 19th or 20th. And it was done, I found this out through Governor Beshear's office. So his office started doing daily briefings about the coronavirus and has done them almost every day until like the last 3 weeks or so. It's a little bit more sporadic now. So that's the only place I could go to find the data. I did contact the Green River District Health Department early on about doing this, and at the time there was a lot of confusion about the accuracy of the data, and testing was so limited early on. There was difficulty in knowing how accurate the data was in terms of daily reporting versus every couple of days and that sort of thing. So, but it was all that we had, but they wanted to hold on to the data at that time. Now the Green River District Health Department has done a great job. They report the data every day. I think they've been doing it every day for quite some time. But early on, there were some reservations about that. I was really concerned about tracking this early on, and I just didn't see locally. This was before the fiscal court got involved and the mayor's office got involved, and before emergency management got involved. And I was very concerned, locally. I didn't see anybody really giving attention to this, so I started doing this. And so, what you're looking at here, what I did is I took the daily reports from the governor's office and I charted these, right? And so you're going to see some places where there are gaps. That's because the data, I never could get it for whatever reason. Perhaps the governor's office didn't do a presentation that day, or for whatever reason I missed the data, getting the report. And you can see a few more instances of that to the right side of this bar chart. But what you also, so in the blue you're seeing the number of cases for Davis County by date, okay? The number of cases that are reported. So what I've decided to do about a month ago is to include this measure that is the moving average. That's a 7-day moving average. What is and you see this at the national level and at the state level, but we didn't see any of this at the local level. Just maybe last week, Davis County Fiscal Court started posting longitudinal data. And I've leaned on Al Mattingly about this for a little while. Again, this is something that I do. I'm comfortable with doing this. I understand the value. The thing about looking at it one day, and let me just pick an example here. If you just look at this one day, there's 21 cases. That's the second highest report since March 19th. But you look the day before, it was 3, and the day after, it was 1. And so you got to be really careful about looking at one day. You've got to look at this over time. And so that's what that moving average does. What the moving average does, it takes every new data point and averages the previous 6 days with that 7th day. So it keeps moving, right? What that helps to do is it helps to eliminate the noise in the data, and the noise in the data are these blue lines. So the moving average is helpful because as we were seeing with the early testing, some days they would be 0. The next day they may be 14 or 9 or 5. They were kind of all over the place. And the other questions about this data, when those tests come back, are they for that day? How long has somebody been sick for when they got tested? There's a lot of questions about the validity of the data. So the moving average is a really good average in statistics to use. And so that's why you see this. Now, the most recent data from the Davis County Health Department, the Green River District Health Department, today is 11. And this is another reason why I'm showing you this today. I've been posting these every 2 weeks or so. And that's kind of been the rule of thumb in the people that are doing the coronavirus data analysis, because there's an incubation period of several days to 14 days. And it's just generally the rule of thumb to look at averages every 7 to 14 days to really get a handle on what's going on in a community or at the state level with new coronavirus cases. So again, that's what you're looking at here. This is new coronavirus cases, okay? Now, something else I want to point out. This is from, I was looking at per Governor Beshear's press conferences from March 20th to June 15th. I wanted to stick with a reliable data source. His office was reported in daily, and then they kind of, dropped off doing that. So I want to be careful about looking at the data since June 16th. I would like to get another week's worth of data before I start looking at averages again. But keep in mind that the governor's office data is really what the health departments are reporting to the governor's office. But sometimes there's a day lag or 2 days lag, and so I want to be careful about looking at two different data sources here. But I'm still comfortable in showing you this. This evening. So, our biggest time period, the biggest rise that we had in Owensboro, Davis County with new cases was April 6th through about May 6th. And then we've experienced almost a complete leveling off of the coronavirus. And it's great. But as we start opening back up, as people start going to restaurants, maybe churches, people start going out in public a little bit more. If people are asymptomatic and they have the coronavirus, then it's quite possible that people will catch it and it'll start spreading again. And it's probably what we're seeing right here, okay? So I'm going to post links to all of this in the comments below. So let me show you some things that I've been looking at. Now, I want to show you where you got to be careful about looking at data, all right? Be careful about looking at Bill Gates there. But I had an image pulled up here. Let me see if I can, they've updated it. So, here's the image I wanted to show you. So CNN has been providing this image pretty regularly in talking about new cases of the coronavirus, okay? So what I would like to do is point out a couple things to you about this. I'm sure if you watch CNN, you've seen this, but what they're doing is they're tracking new cases in the past week versus the previous week. So there's that 14-day window, so to speak. And, this can easily go from red to orange to yellow. This is what you got to be really careful of, okay? Let me show you why. So, and I'm talking about this because I have family members that watch the news religiously, and they are getting everything they're understanding about the coronavirus based on national news. And I'm here to tell you that you've got to drill down further than the national level. You got to drill further down than the state level. You got to drill down to the local level to really know what's going on with this. And the reason why I say that is because localities across a state are experiencing the coronavirus differently. Some localities have higher infection. Some areas within communities are more likely to experience infection than other areas. For example, nursing homes. Now, nursing homes, oddly enough, they've been hard hit in the state of Kentucky, but they had not been hard hit in Owensboro. So, are we lucky, or is it also because we've been doing a good job? The staff and the people, the first responders, the medical personnel in these living facilities have been doing a great job. So thank you, right? We thank those people. And the reason I bring up nursing homes, 65% of the deaths in Kentucky associated with the coronavirus, 65% of the deaths come from people that were in a nursing home. Now think about that, okay? So yeah, the coronavirus is an infectious disease. It's out there. We know that it hits a group of people harder than others. I've been tracking this nursing home data for several months. You don't hear about that a lot. People that are in close quarters that are at higher risk of serious, if they contract the coronavirus, high risk of being very sick and maybe dying, those are problematic places that we have to be paying attention to. And that has been no more illustrated than in the state of Kentucky. Now, I don't know that data in other places, but I don't know the data in other places, but we hear all the time early on, there were rapid infection on cruise ships, rapid infection in the nursing homes in Oregon, rapid infections in prison populations, rapid infections, people getting together for a party, rapid infections, people getting really close together in venues and churches, right? My rule of thumb personally, if I could say something to you that might help you out, stay out of groups, okay? Stay with people that you're with. My family, we can stay together because we're all living together and we know what each of us are doing. But when you go out into a group of other people, especially if you're not social distancing, people are not using this, people are not using hand sanitizer very much, the risk is worse. Michael? Michael?
It was one word.
Turn it off now and be quiet. Turn it off now.
I'm not talking to anyone.
Hey, I'm live, please.
I'm not talking to anyone. That was the one time.
Turn the TV off now. Sorry. So, the data, right? So, stay out of groups. Now, you know, the argument is, well, how are we going to open back up? How are we going to go back to school? It's a good question. You know, are we going to use these things? I mean, at a minimum, are we going to use these things and everything else? Those are the things that we know that minimizes the infection, the transmission of the coronavirus, right? You know, it's kind of funny because early on there was belief that masks didn't work, and some new research out on this, on the impact of masks, is quite remarkable. You know, I use a mask wherever I go outside my home, and I would encourage you to do the same. And I think that we ought to be having a public health campaign in Owensboro, Davis County about this. Using masks, hand sanitizer, social distancing, minimizing your contact in groups. We can't wait for the federal level to do this stuff. You know, the state has got their hands full. We should be having a public campaign in Owensboro, Davis County about using masks. Okay? We should be doing that. So, there's that. Now, let me show you something though. So this is how the media is portraying this. Not a really good way to communicate the rise and fall of coronavirus across communities is what they've used. It's not good. Let me show you, even if you drill down a little bit further. So this is a website, and I'm not sure if you can see this up here at the top, but it's basically COVID-19 spelled backwards. It's a group of researchers that has become, you know, it's a group of epidemiologists is what it is. It's become the location to go to get information about the coronavirus. Okay, they've been collecting all this and everything. And what I have highlighted are new confirmed COVID-19 cases per day by U.S. states and territories. And here we are in Kentucky. This is as of today, I believe. The date's not on there, but I believe, yeah, that was, I believe, either today or yesterday. This blue line is Kentucky. Look at that. That's us. So we've done the right thing in the sense of tamping down this pandemic, tamping down infections, tamping down hospitalizations, tamping down deaths. That has occurred in Kentucky. Okay. Now, you know, let me show you something about South Carolina. I mentioned having gone there, and this is something that I looked at prior to us going on that trip. So we left, I think, May 30th, okay, which would be right around here. Let's see. That's May 18th. We left right May 24th. So we left right here on this day, okay? Or the next day. We left right here. So you could see that's very similar to where Kentucky was. And so we felt really good about going and just doing our thing. And, while we were there was a little bit of an increase, not a whole lot. And then we were back home on the 6th, right there. Now, since that time, look at this. Since that time, look at what's happened in South Carolina with new cases. Okay, so I was talking with a friend of mine who has a daughter who's going to Myrtle Beach, and I said this stuff changes week to week, and you have to be mindful of the data and where we are and what the trend is. Knowing what's going on in South Carolina right now, we probably wouldn't go. I don't think we would go, but also at the local level, I think that the mayor of Myrtle Beach has declared a state of emergency the last couple of days. So, it's remarkable how much this can change in a short period of time. Something else, let's see. So, we've heard recently about how steep California is right now. We've heard about Texas. You can see that's massive changes in a short period of time. Florida, you can see the same. Arizona, we heard a lot about these places in the last week or so. North Carolina has also, I think they declared a state of emergency. Oh, actually, I believe the governor is talking about mandating masks for people in the state. There's been talk about that. Of course, Georgia as well. But, again, going back to Kentucky, if we could find where it was, some other states that are comparable to us. Let me show you. There's Kentucky right there, right? Anyway, you saw it. Let me show you Connecticut, because Connecticut started out really high, and they got really serious about social distancing, about closing down, and mask and hand sanitizer and all of that, and they really have brought the new cases down substantially. Look at this, normalized by population. Let me show you this by state in the United States. Not sure what that, there we go. So when you start normalizing of a population, and what they're looking at here is the rate of new cases per 1 million people. And so then you can compare state to state and really see how each is doing. Again, the state of Kentucky is one of the best. Here's actually where I wanted to show you Connecticut, because you can see what can happen if you do the right thing as well. So they went up really high and they brought it back down, right? In contrast, if you want to look at Arizona in isolation, they had it relatively low, and that's probably why they decided to go on a plan of reopening. And now, well, they've got a problem, right? They have a problem, a serious problem there, okay? So this, again, is one of the sources that I'm using to follow this and to understand this. And this is also why, I started doing this local, looking at the trend over time to see rises and declines, peaks and spikes, and that sort of thing. There's that. And I'm also tracking this on my blog, and a couple of things I'll show to you real quick here. So I've been updating this about every 2 weeks. So here are some things that I want to present to you about this. So back in, we saw a problem with deaths in long-term care facilities. We start to see that, nursing homes and that sort of thing. Started to see this back in April. Let me show you something. So this is something I posted on April 14th. 30% of the deaths in Kentucky related to the coronavirus stem from long-term care facilities. Now, long-term care is generally nursing homes, okay? I don't think that included prisons and related populations. So that was 30% on April 14th, 38% on April 20th, 46% on April 25th, and as of June 25th, it's 65%. Okay, so I think once you get some perspective on what's going on, you can better plan and have a better handle on how to navigate this, how to live with it. I'm going to end right there because it's been going on for about 45 minutes or so. I don't see any questions. One last thing that we'll share with you, the Centers for Disease Control announced today that for every one infection, 10 other people were infected. So while we're looking at documented cases, they estimate that there's 20 million cases, there have been 20 million cases of the coronavirus to date. Now, officially, I think the numbers I saw this afternoon in the United States is 2.5 million. The number of confirmed cases of coronavirus is 2.5 million. But the Centers for Disease Control, based on some recent research that they've released, estimate that it's probably around 20 million. So how do we know about that 18 million? Well, because asymptomatic people that get sick but not really sick and they don't go to the hospital. So more of it is out there than maybe we are seeing in the number of actual cases. So practice good public health. Wear your mask. Keep your hands clean. Practice good social distancing and take care of yourself and your family. Again, if you have any questions, please feel free to post it in the comments below. I'll be happy to come back and answer your questions at a later date.